Angelo Giardino. I'm the Chief Medical Officer for Texas Children's Health Plan. I'd like to thank you for joining us, and we'd like to discuss April, which is Child Abuse Awareness. Child abuse and neglect is a significant problem that confronts the children and families in our community. I'd like to share some of the numbers for Texas and then the Houston region, just to give you an idea of the size and scale of the problem. Each year in Texas, about 260,000 reports are received. Those reports are processed, and a subset of them are investigated. After that investigation, approximately 66,000 cases of child abuse and neglect are confirmed. So that means 66,000 kids each year in Texas are victims of child abuse and neglect. And sadly, in 2013, 156 children in Texas died from child abuse and neglect. Looking more locally in the Houston region, we have about 1.8 million children that live in that large metro area. And if you look at the reports, there were about 46,000 reports of suspected child abuse and neglect in 2013. Those get processed and investigated, and after those investigations, about 9,000 children were confirmed as victims of child abuse and neglect. And sadly, 30 of those children died as a result of child abuse and neglect. So despite a lot of prevention efforts, the numbers I just shared with you show just how significant this problem is, and really underscores why we need a Child Abuse Awareness Month in April, so that we can redouble our efforts in the clinical setting to identify and refer these children and families for services and supports. Turning our attention to the clinical setting, physicians and nurse practitioners and physician's assistants share the responsibility for conducting histories, physicals, and reviewing labs and imaging studies. That's the clinical work we do, and that's where we can identify and then refer a patient who may be at risk for child abuse and neglect. So let's look at physical abuse first. With physical abuse, the child has an injury. Either they've presented with an injury, or during their examination you uncover one. So we go back to first principles. The healthcare provider will do a history. In other words, get the story from the parent or the caregiver. Then do a physical exam, order any labs or images, and then you have to put that together. Does the story seem plausible for the injury that you're seeing on physical examination? If it does, then you move on. If it doesn't, you really have to consider child abuse and neglect in your differential diagnosis. So for example, a child who's 4 months old, who has bruises on their trunk, would be very suspicious for abuse, because the history would be hard to explain how a child who doesn't walk got injuries on their trunk. So that's a case or an example of where the differential diagnosis would have child abuse and neglect very high on the list. In cases of child neglect, the child's basic needs are not being met by their caregiver. The way that tends to present itself is over time, the healthcare provider will notice that some basic needs, whether they be for food, hygiene, safety, or supervision, are not being met. It's really important when you're looking for those subtle aspects to see the kid over time, and that's why we're so focused on providers in our network at Texas Children's Health Plan following the periodicity schedules published by EPSDT and Bright Futures. During those visits, over time, one could assess whether or not the child's basic needs are being met. Certainly, if neglect is suspected, reports need to be filed so that the families can get the services and supports they need to meet those basic needs. Sexual abuse is a particularly challenging topic for professionals and the lay public to understand. Sadly, every year in our community, children are sexually abused. Those cases present a bit differently than physical abuse and neglect. Those cases tend to present with a non-specific behavior change in the child that the caregivers or the teachers at school notice. Those non-specific behaviors are just that, very non-specific. They're stress-related, so the child might not sleep as well, appetite might be decreased, their school performance may wax and wane. So the differential diagnosis needs to keep sexual abuse high on the list when there's a case of non-specific behavior change and concerns on the parts of the caregivers for people who might be harming the child. Most primary care providers don't feel comfortable doing a full-blown sexual abuse evaluation, and we're really fortunate at Texas Children's Health Plan to have two academic programs that have child abuse pediatricians, one at Baylor College of Medicine and the other one at UT Houston, where there are expert teams who can assist the primary care provider in conducting that evaluation. Since this is April, Child Abuse Awareness Month, it would be important to talk a bit about the mandated reporting responsibility that comes when you suspect child abuse and neglect. The first thing is that doctors, nurses, and physician's assistants are definitely mandated reporters. And that means, by Texas law, that within 48 hours of suspecting a case of child abuse and neglect, you do have to make a report. You can make the report using the Child Abuse Hotline, which is available 24 hours a day, 7 days a week, or alternatively, for cases where you're not concerned about immediate safety of the child, you can use the website to make that report as well. Child abuse and neglect is a sophisticated area in pediatrics. So for more resources in this area, I have two recommendations. One, on the national level, the website from Prevent Child Abuse America has a great deal of information on the topic from the national perspective. And then for a more local flavor, the Texas Health Step website that offers the online training modules has a program on recognizing and reporting child abuse and neglect. And the benefit with that one is that it's free, it's online, and you get a CME credit if you complete it. Thank you for taking the time to join us today. I know child abuse and neglect is a difficult topic, but it's one that confronts the children in our community, and we want to serve those children and provide access to the services and supports to their families so that they can be safe and grow into the wonderful children that they should be.